Hello everyone, I am Raviteja and today we are going to discuss the topic of disorders of growth part 1 short stature. This video is presented by MEDeaze and MBBS freaks. Short stature is an important university question. The definition of short stature is height below third percentile or less than -2 standard deviation below median for age and sex. Let us know some terms. Chronological age. It is the age of the child from date of birth. Bone age. It is the estimate of skeletal maturity of the child. We can know the bone age by X-ray of left hand and wrist. Height age is the height that should be achieved by the normal child at what age? Example, a 7-year-old child is 100 centimeters, but a normal child achieves 100 centimeters by the age 4 years. So the height age of this child is 4 years, but chronological age is 7 years. Upper segment lower segment ratio. The part of the body above the pubic symphysis is known as upper segment and below it is known as lower segment. This ratio is important to determine whether the short stature is proportionate or disproportionate. Upper segment lower segment ratio is 1.7 at birth, 1 at 10 years, zero point 0.9 in adults. Etiology. Short stature can be divided into proportionate and disproportionate based on upper segment lower segment ratio. If this ratio is normal, it is proportionate. If upper segment lower segment ratio is increased or decreased, it is disproportionate. In proportionate, we have physiological and pathological short stature. In physiological, we have familial short stature and constitutional delay in growth and puberty. In pathological short stature, the causes are undernutrition, chronic systemic illnesses like congestive heart diseases, congenital heart diseases, chronic liver diseases, chronic kidney diseases, endocrine causes like growth hormone deficiency, hypothyroidism. Other causes are intrauterine growth retardation, small for gestational age. In short stature with short limbs, the upper segment lower segment ratio is increased. That is, upper part of the body will be more. It is seen in rickets, achondroplasia, congenital hypothyroidism. In short stature with short trunk, the upper segment lower segment ratio is decreased. That is, the lower segment is more. It is seen in vertebral anomalies and spondyloepiphyseal dysplasia. Let us see familial short stature and constitutional delay in growth and puberty. The familial short stature, that is, there is a family history of short stature. The parents are short, so the child will be short. In constitutional delay in growth and puberty, there is delay in growth and puberty. That is, the child is growing late. Let us see two examples. There is a girl with familial short stature and boy with CDGP. The height in both the cases is less. The height velocity is normal in both the cases. In FSS, the family history, there is a history of short stature. In CDGP, there is a family history of delayed puberty in parents. So the puberty in CDGP is delayed, but in familial short stature, it is normal. The final height in familial short stature is less. In CDGP, the final height is normal. See in this chart, when the child is below the third centile and she is growing below the child's third centile, but the overall height is less, but she achieved the target height. In familial short stature, there is a target height according to the parent's height. So the overall height is less, but she achieved the target height. The triangle indicates bone age, and the circles indicate chronological age. In this graph, the bone age is corresponding with chronological age. That is, the bones are growing according to the age. So, in familial short stature, the bone age is equal to chronological age. In this graph, you can see the boy when he is born, the height is normal, and then he is growing less than third centile, but at the end he is achieving normal height. But here you can see the bone age is less than chronological age. That is, bones are not growing according to the age. So in CDGP, chronological age is greater than bone age. The other causes are undernutrition. It is most common cause. Endocrine causes are growth hormone deficiency, hypothyroidism, Cushing syndrome. Then there are skeletal dysplasias, genetic syndromes like Down syndrome, Turner syndrome. The psychosocial dwarfism is emotional deprivation dwarfism. It is caused due to unhappy homes. Small for gestational age. It is birth weight less than 10th percentile for gestational age. Idiopathic short stature when there is unknown reason. That is idiopathic short stature. Assessment. How do you assess the child with short stature? First, we have to measure the height. Height is measured in less than 2 years with infantometer. In more than 2 years child, stadiometer. Height velocity assessment. Height velocity is how much a child is growing per time. It is indicated in centimeters per year. If there is a decrease in height velocity, it indicates pathological cause. Comparison with genetic potential. Here we will use mid-parental height. That is, in boys, this formula is mother's height plus father's height in centimeters divided by 2 plus 6.5 centimeters. In girls, it is mother's height plus father's height in centimeters divided by 2 minus 6.5 centimeters. So the mid-parental height gives the target height for the child. Then body proportion assessment. You can assess the body proportion by upper segment lower segment ratio. It gives whether the short stature is proportionate or disproportionate. Sexual maturity rating. It is done in children above 7 years. Why it is important is because when there is precocious puberty, there is early height spurt, and early closure of epiphyseal plates that leads to short stature. In delayed puberty, there is delayed height spurt that also leads to short stature. Differential diagnosis. How do we arrive at a cause of short stature? We can know the differential diagnosis through history, examination, and investigations. In history, there are certain clues like low birth weight. It gives clue for small for gestational age. There is chronic diarrhea that may be malabsorption. There is lethargy, constipation, weight gain that may be hypothyroidism. There is inadequate diet intake, that may be undernutrition. In examination, if there is a disproportion, there is skeletal dysplasia, rickets, hypothyroidism. If there is frontal bossing, depressed nasal bridge, dental anomaly, small penis, that may give clue to hypopituitarism. If there is central obesity or striae, it may be Cushing's syndrome. In this way, we can know the cause through history and examination. Investigations. There are three levels of investigations. The first level, that is essential investigations to be done in a child with short stature. They are hemogram with ESR, bone age, urinalysis, stool examination, blood urea, creatinine, pH, albumin. If these values are normal, we have to proceed to level 2 investigations. They are serum thyroxine, serum TSH, then karyotype in girls to rule out Turner syndrome, and celiac serology. If they are normal, we have to proceed to level 3 investigations. They include serum insulin-like growth factor 1, insulin-like growth factor binding protein 3 levels, provocative growth hormone testing, and MRI brain. So, in this way, we have to perform the investigations. Management. The general principles of management in any child with short stature are counseling the patient, counseling the parents, dietary advice, which includes balanced diet with recommended micro and macronutrients. And the important thing is accurate monitoring of height velocity. The height velocity should be monitored in children with short stature. In physiological short stature, we have to reassure the parents and we have to do annual height and weight monitoring. That is enough in physiological cause. In pathologic causes, we have to treat the underlying condition. Examples, renal tubular acidosis or celiac disease. If there is hypothyroidism, we have to give levothyroxine replacement. If there is growth hormone deficiency, we have to give subcutaneous injections of growth hormone. You can assess yourself with these questions. Thank you all.